Welcome. Have you ever stepped off a boat and felt like you were still rocking back and forth? For most, that feeling fades quickly. But for some, that rocking, swaying, or bobbing sensation never goes away. This persistent illusion of movement is called Débarquement syndrome, or MdDS. Join us as we delve into this perplexing and often debilitating condition. The exact cause of MdDS remains a mystery, but researchers believe it involves a mismatch of signals between the eyes, the inner ear, and the brain. Typically, when we travel, these systems work together to maintain our balance. When we stop, they readjust. In MdDS, this readjustment malfunctions. Several triggers have been identified, with prolonged sea travel being the most common, hence the name, which literally translates to sickness of disembarkment. However, MdDS can also be triggered by air travel, car rides, train journeys, and even just prolonged exposure to virtual reality or certain visual stimuli. In some cases, no trigger is identified at all, and this is referred to as spontaneous onset MdDS. Hormonal fluctuations may also play a role, with some women reporting symptom onset or exacerbation related to menstruation, pregnancy, or menopause. The underlying mechanism of MdDS is still being investigated, but the current prevailing theory suggests a problem with the brain's ability to adapt to changes in sensory input, specifically relating to balance and spatial orientation. Normally, the brain uses a complex interplay of visual, vestibular inner ear, and proprioceptive body awareness information to maintain equilibrium. In MdDS, this process is disrupted, possibly involving areas of the brain responsible for sensory integration, like the cerebellum and the vestibulo-ocular reflex pathway. Functional MRI studies have shown altered brain activity in individuals with MdDS, providing further support for this theory. It is thought that the brain gets stuck in the motion, adapted state, even when the actual motion has ceased. MdDS is considered a rare condition, although its exact prevalence is difficult to determine because many individuals go undiagnosed or are misdiagnosed. Studies suggest that women are 4 to 5 times more likely to develop MdDS than men, though onset typically occurs in middle age, between 40 and 60, although it can affect people of all ages. Awareness of MdDS is growing within the medical community, leading to improved recognition and diagnosis rates. The primary symptom of MdDS is a persistent sensation of rocking, swaying, or bobbing. This feeling is often described as being on a boat or walking on a trampoline. This sensation is usually present even when standing or sitting still, and can be exacerbated by fatigue, stress, or visual stimuli. Many individuals with MdDS also experience other symptoms, including dizziness, imbalance, difficulty walking, headaches, brain fog, anxiety, depression, and visual disturbances such as sensitivity to motion, difficulty focusing, and blurred vision. These symptoms can significantly impact daily life, affecting the ability to work, socialize, and perform routine tasks. There is no single diagnostic test for MdDS. Diagnosis is primarily based on a detailed medical history, a thorough neurological examination, and the exclusion of other conditions that can cause similar symptoms. The diagnostic criteria typically include the presence of a persistent rocking, swaying, or bobbing sensation for at least 1 month following exposure to motion, or spontaneous onset. Additional tests, such as vestibular testing to assess inner ear function, neuroimaging MRI or CT scans, and blood tests, may be performed to rule out other possible causes of the symptoms. A careful evaluation by a physician experienced in diagnosing and treating vestibular disorders is crucial for accurate diagnosis. MdDS is broadly classified into 2 main types: motion-triggered MdDS and spontaneous onset MdDS. Motion-triggered MdDS, as the name suggests, occurs after a period of motion exposure, such as sea travel or air travel. Spontaneous onset MdDS, on the other hand, develops without any identifiable trigger. While the symptoms are similar in both types, the underlying mechanisms and treatment approaches may differ slightly. Unfortunately, there is currently no cure for MdDS, and treatment focuses on managing symptoms and improving quality of life. A variety of approaches may be used, often in combination. Vestibular rehabilitation therapy, which involves exercises to improve balance and coordination, can be helpful for some individuals. Medications, such as benzodiazepines, selective serotonin reuptake inhibitors, SSRIs, and migraine medications may be prescribed to alleviate symptoms like anxiety, depression, and headaches. Transcranial magnetic stimulation, ATS, a non-invasive brain stimulation technique, has shown promise in some studies and is being investigated as a potential treatment option. Lifestyle modifications, such as managing stress, getting regular exercise, and avoiding triggers, can also help in managing symptoms. Because the exact cause of MdDS is unknown, there is no guaranteed way to prevent it. However, some strategies may help to reduce the risk. For individuals prone to motion sickness, taking precautions during travel, such as using motion sickness medication or acupressure bands, may be beneficial. Avoiding prolonged exposure to virtual reality or other visual stimuli that can trigger symptoms may also be helpful. Maintaining a healthy lifestyle, including getting enough sleep, managing stress, and staying hydrated, can contribute to overall well-being and potentially reduce susceptibility to MDS. The prognosis for MdDS varies. Some individuals experience a gradual improvement in symptoms over time, while others have chronic, persistent symptoms. Early diagnosis and intervention are important to maximize the chances of a positive outcome. Recent research is focusing on identifying the specific brain regions and neural pathways involved in MdDS, with the goal of developing more targeted and effective treatments. Studies are exploring the potential of various therapies, including repetitive transcranial magnetic stimulation or TMS, and specific vestibular rehabilitation protocols. Understanding the underlying mechanisms of MDS is crucial for developing a cure and improving the lives of those affected by this debilitating condition.